Which finding is most consistent with a diagnosis of status asthmaticus? Would it be A, audible crackles on inspiration, B, improvement after a single albuterol dose, C, silent chest with minimal air movement, or would it be D, productive cough with green sputum? Now, the one thing that I want you to first think about with status asthmaticus is that this patient not only has asthma, but they're trying to treat it with their inhaler and it's not working. That's what's going to make it status asthmaticus. Remember, as EMS, I always want to know, did my patient try to treat it themselves? How many times did they use their meter dose inhaler? Was there any relief? If there's no relief, this is a bad sign. And oftentimes these patients can deteriorate pretty quickly. And looking at these answers, A, audible crackles on inspiration, that's not a sign of asthma, right? With asthma, I'm gonna have lower airway obstruction through wheezing, right? Bronchial constriction. So I can go ahead and roll that out. Now, there is some mucus production that does occur in asthma, but having a productive cough is something that I would see more in like a pneumonia patient or even a bronchitis patient. So I'm going to rule that one out as well. B says improvement after a single albuterol dose. And again, the whole purpose of status asthmaticus is that the patient is not improving with their albuterol dose. That makes the best answer in this situation C, a silent chest. Silent chest is a very bad sign. That just means that you're listening to the lung sounds and you have no lung sounds, even though you're visually watching somebody breathe and you're not hearing anything inside their chest. That just means their bronchioles are so constricted that there's no airflow. And because of this, you're going to have to treat this patient with more beta 2 agonists. I want you to give epinephrine 1 in 1000 IM early, another albuterol and atropine treatment. I want you to give your corticosteroids, and even mag sulfate is the one drug that you are going to need an IV for. So early medications are important in this patient. Another word of advice, treat this patient there. Unless there's a trigger, right? Unless something is causing that asthmatic attack where you're at, try to treat them there. Don't have that patient walk to your stretcher. Try to get these medications very early on board. Moving this patient around or having them exert themselves to get onto your stretcher can have detrimental effects. So, again, the answer is C.